Okay, so now that we have a better understanding of where compartment syndrome occurs and why it occurs, I want to get into some of the known, widely recognized causes of compartment syndrome, the kinds of potential triggers that every competent medical provider should be aware of. The first one, that is perhaps the most classic cause of compartment syndrome, is a fracture. So if someone breaks a bone in their arm or their leg, it should be understood that they are at an inherent risk of developing compartment syndrome. Again, recall that the anatomy of both the legs and the arms are divided into compartments or little chambers that consist of muscles, nerves, and blood vessels that are all wrapped in this tight saran wrap-like material known as fascia. That fascia is not giving, so if anything causes fluid to accumulate or inflammation or swelling to accumulate inside of that fascia, that's going to cause harm. So the first widely recognized cause of such a complication, such a serious malady, is a fracture. A second is a severely bruised muscle. So if somebody gets kicked in the thigh or experiences some other sort of blunt force trauma to the soft tissue of one of these compartments, well, the adjacent or the consequent swelling that can develop from that severe bruising can also cause fluid and swelling to accumulate within the chamber, within the compartment, that can go on to then cause compression of blood vessels, compression of nerves, that can lead to permanent death of both nerves and muscle. A third widely recognized cause of such compartment syndrome is a syndrome or a condition known as a crush injury. As the name implies, that basically means that you got crushed by something. Some sort of heavy object compressed the area for a while that resulted in the accumulation of fluid and swelling within a compartment. Now, here's one that most people don't think of, and in fact, a lot of medical providers forget about, is that the use of steroids, anabolic steroids, commonly used in gyms and in other places, well, that can set you up for the development of compartment syndrome. Although the underlying mechanism is not completely clear, it is widely speculated that the reason why anabolic steroids can do this is because the muscle growth is so rapid that it can sometimes cause micro tears in the development of the muscle that can then cause edema and swelling within the compartment, leading to compartment syndrome. The fourth, or I should say the fifth cause, is the use of constricting bandages. A lot of times, with the best of intentions, a medical provider will wrap an area that has an infection or has some other problem with a bandage, but wrap it perhaps too tightly, or apply a cast, but again, apply the cast too tightly, and that compression can result in the development of compartment syndrome. Just think of the last time that you had blood work done and the phlebotomist put the tourniquet on your elbow in order to obtain the blood from your antecubital fossa. If that tourniquet is left there too long, you can within minutes begin to experience numbness and tingling and swelling of the lower portion of the arm. So just imagine if you had constricting bandages or even a constricting cast that were to do that, the kinds of harm that could ensue. The final cause of compartment syndrome that I want to talk about is something widely understood as a reperfusion injury. So this one is perhaps the most difficult to understand or to imagine. So there are many patients that have a blockage in a blood vessel. As a result of that, the tissue downstream gets accustomed to a certain amount of blood flow, a certain amount of blood moving through the area. A lot of times, a doctor, particularly an interventional type of a doctor, that's a doctor that may be a cardiologist or an interventional radiologist, they'll go in, oftentimes with a catheter, and try to open up the blockage in order to reperfuse, in other words, to reintroduce into a space that has become accustomed to a compromised amount of blood flow, more blood flow. Well, one of the paradoxical things that can result from that sudden increase in the blood flow to a particular compartment or area is that as a result of that, fluid can develop within that compartment, swelling can develop within that compartment, and suddenly now you again could have the development of compartment syndrome. So in summary, we've gone over 6 major, widely recognized causes of compartment syndrome, and they include a fracture, they include bruising, severe bruising of muscle, crush injuries, the usage of anabolic steroids, the usage of constricting bandages or casts, and finally, the reperfusion injury that can actually be caused by the good intentions of an interventionalist doctor like an interventional radiologist or a cardiologist.